How you doing? My name is Jared Hoff, and this is my presentation on smoking cessation. My project was geared to design a worksite health promotion smoking cessation intervention program for a company to increase or decrease the amount of smoking and increase the overall health of the workers of the company. So this presentation will contain an overview, needs assessment, target behavior, basics of the program, and benefits, overall benefits for the company for this worksite intervention initiative. So as an overview, we will be carrying out this worksite promotion intervention at a hospital. Number one, specifically the Cleveland Clinic Hospital, where we will use approximately 1,000 workers from 1,000 participants from the Cleveland Clinic. These participants will be middle to upper class workers consisting of doctors, nurses, technicians, and other health employees within the hospital. The health promotion intervention will also take place within the hospital, and it won't be any like external facilities. It will be using all the Cleveland Clinic facilities to save money, and we're already in the hospital, so it makes sense. The age range we're looking at is from 25 to 65, so it's a pretty wide range. The needs assessment, we're going to use a survey. Usually surveys focus more on health concerns, so it's pretty fitting for what we're trying to accomplish, and it also works great with the masses. So relatively large populations, usually do the survey method because it's easy to use. Participants are familiar with the process of the survey, and also they're easy to evaluate. At the end, we're going to also include some open-ended questions to gain more information. So open-ended questions are, questions that we'll ask that can be answered on a spectrum. So for an example, 10 would be of the highest concern to a 1, which would be the lowest concern. And then the closed-ended questions will be questions such as, have you smoked in the past week? And those are yes or no questions that will be the closed-ended questions of the survey. We will also have a section for behavioral, environmental, and health concerns in the survey as well. So our target behavior is ultimately to get workers or participants to stop smoking for those who are actively smoking. And our second is to decrease the amount of cigarettes that these participants smoke per day. The behavior modification, we're going to, these participants will be enrolled in classes that will teach them the skills and education, and it will educate them on, the effects of smoking, and will also help them, give them tools to help them to quit and find alternatives to smoking. As far as environmental and policy changes, we're going to, implement a lot of physical changes to the hospital. We're going to put up a lot of posters, no smoking posters in doctor's office and clinicals. We're also going to remove all the ashtrays away from the hospital, and we're also going to implement a zero tolerance, no smoking policy within the hospital, in and around the hospital. For about 500 feet, there will be no smoking in or around the hospital. And especially not from any of the staff. We don't want to portray that image. For our evaluation, we will hold the intervention. The intervention will last for about a month, and we will be taking surveys at 6, 12, and 18 months after the completed intervention to gain information on the effectiveness of the program. And the goals, what we're looking for, is to get more than 50% to lower their rate of smoking of the participants overall. Our second initiative is to we want at least 12 to 20% to to set goals to become abstinent by a certain date. And then we want 30% to just to completely stop smoking. So those will be the participants to have remained abstinent from smoking by the 18-month check mark.